What you don't know could kill you. And that's not being an extremist. Please hear me out on this. So this morning, I decided to use this little kit that I got. Now, I bought this kit in my first week of changing my lifestyle because I read somewhere that it was really important to check your ketone level and your blood glucose level, because that would determine how much weight you're going to lose and also determine how your metabolic health was going. Now, me being a rookie at this, I used almost all my strips and blew it and only got error messages. But the other day, my husband and I figured out how to use it. So this morning, I decided to check my fasting blood sugar level. Now, I was sure that it would be fine because I have been fasting, intermittent fasting 20 hours a day, and eating no carbs for the last month. I've lost 7 inches off my waist. I've reversed my blood pressure problem. And I thought, well, obviously, even if it was kind of high back then, it will be down in normal range. Now, normal range is somewhere 70 to 100, not 100, but 99. 70 to 99 is about normal range. If you're in 100 to 129, you are in the pre-diabetic state. And if you're 130 or up, you are in the diabetic state. Okay, so I was pretty sure. I thought, well, maybe it'll be around 70 because I've been, my doctor never told me I was pre-diabetic or had diabetes. So if I go in every year and she doesn't even test for it and doesn't tell me, obviously it's not even something she's worried about, right? And if my doctor doesn't test, she's the one who knows this stuff. I don't know this stuff. I don't even know what I should ask for. I don't even know what tests I should ask for. So obviously, I do not have prediabetes or diabetes, even though people around me were now getting diagnosed with prediabetes or diabetes. So this morning I went to test it. And wouldn't you know, my blood glucose level, fasting, after a month of being on keto, which brought it down considerably, I'm sure, was 103. I actually tested out as pre-diabetic this morning, guys, which means that I was either very solidly in the pre-diabetic category or in the type 2 diabetes category and did not know. Do you know that there are millions of people in America that have type 2 diabetes or are pre-diabetic and do not know? It's not that they're not going to the doctor to check it out. I'm sure some aren't. But there are a lot of people that go to the doctor every year and still have no idea where they stand with their blood sugar levels. And that is this fatal mistake, because what you don't know could kill you. Because if you are insulin resistant and if you have type 2 diabetes or are pre-diabetic, you are that much more at risk for cancer, heart disease, or a stroke. That's scary, because those are the killers right now in America, aren't they? Those are the things that get you. They're getting everybody in their 40s through 80s. Usually I found that the people that make it to their 80s don't have as many problems. But in this little middle category, there are a lot of people that are dropping dead from heart attacks or having strokes or are fighting cancer. And it's because their blood glucose level was too high and they were never told. They didn't even know. And that is scary to me. It is scary to me that I asked my doctor straight out. I said, my sister was afraid she had diabetes. Now, my poor sister had heart disease and didn't even know she had diabetes. And I don't know that she had diabetes, but I would wager a guess that she did. She was terrified of being diabetic. And when I said that to my doctor, she said, oh, a lot of people, they're really heavy, but they don't have diabetes. And I went, oh, that's weird. She goes, yeah, we don't really know why. I thought, huh. And then I said, I'm kind of afraid about my blood sugar levels and that I have diabetes. And she said, she looked over at my A1C test that she did 3 years earlier and said, no, you're fine. I'm like, okay. So the doctor just said, I could be really heavy and not have diabetes. And she looked at my A1C and I'm fine. I must be fine. The next year I went in and I said, I'm afraid I might have neuropathy. And she looked at my A1C and said, no, you're fine. The A1C now from 4 years ago. She has never tested my fasting insulin level. Never, never. Which is not something I knew to ask her to test because I didn't hear about it until the last few weeks here on the internet. That is a test that will help you see where you are on the heading toward diabetes category. Or the C-peptide test, which is another test that would be helpful. The doctors don't order these. Every once in a while, they'll order an A1C. If it's normal, they just leave you for 5 years. In the meantime, you have metabolic syndrome, pre-diabetes, and maybe even diabetes, and you don't even know it. And that's why I say what you don't know could kill you. Because I really think that your body is intuitive. And I think that all these few years that I've been in this panic that I'm going to have a heart attack was not unfounded. My doctor thought it was PTSD from my sister dying of a heart attack. And yes, I will grant her that. She sent me to a therapist to work through PTSD of my sister dying. Okay, that's fine. But maybe we should have gone a little deeper with my blood tests. Why, in seeing 2 different cardiologists, did they never check my blood sugar levels? They just asked me, do I have diabetes? And I'd say, no, I don't think so, because I hadn't been tested in years. Why, when I went to the endocrinologist for a few years, having all those endocrinology tests, did they not check my blood sugar level? Why, when I had brain surgery, was I just asked if I had diabetes, but I actually wasn't tested for diabetes? Why? Why do I find out on my own a month after fasting that I'm in a pre-diabetic condition, which probably has, really improved a lot in that time? That is frightening, guys. Yesterday I talked about how it's really important to advocate for yourself. I'm going to go a little further in that today because I've learned another lesson here. It's really important to be a detective. It's really important to figure out what tests you might need. I think my body knew I was in trouble and I was in that high sugar level and I was heading toward one of those things, the heart attack, the stroke, or the cancer. I think I knew it intuitively, but I did not have the words or the medical knowledge to ask for the right things. I didn't even know where to go for it. Because remember, I was still a vegan. I thought that no fat, high vegetables, I was good. When I look at the American Diabetes Association graph right here, I was right in there. In fact, I was better than that graph because I didn't drink the milk, which is high in sugar. So I'm like, whoa, I'm doing exactly what they tell me to do. My doctor isn't testing. I shouldn't be concerned. And guess what? I should have been concerned and I should have been tested. Now, there are some doctors that will not give you the tests you ask for. I have a kind and understanding doctor who would definitely order the tests I asked for, right? But she didn't preemptively order the tests I needed. And I didn't know those were the tests to ask for. I didn't know those were the tests I needed. And I don't know why. I could have a conversation with her and ask her why. But I've got to say, again, you meet with your doctor 15 minutes a year. They sit down with you, they look at your other lab work, and they talk to you. And they might be thinking about someone else. They might be thinking about where they're going for lunch, or they might be thinking about the patient before you and still kind of mulling that through their mind. They might not be completely on top of your labs and what you need. So it's up to you to really figure out what you need. Now, I know you're probably, some of you are saying that is too much. That is why I go to the doctor in the first place. I go to the doctor because I don't know anything about this and I expect them to know about this. I'm afraid not every doctor is that thorough. I mean, my aunt died of colon cancer because the doctor didn't think the polyps in her colon were of any use. I have a cousin who had terrible headaches for a long time and had every neurological test possible, only to find out his blood sugar level was 600. Okay? Totally diabetic, totally type 2 diabetes. No one ever checked his blood sugar level. I had migraines for years and no one ever checked my blood sugar level. What if the whole reason I had such bad migraines was because I was in type 2 diabetes and I was never tested, so I didn't think I had it, and I was going along, just going along. Okay, so this is my recommendation for you. If you go to your doctor in the next little while, ask for your A1C, ask for a fasting insulin. If they say why, say because I want to know how much insulin is going through my system to try to keep my blood sugar stable. Okay, that's going to tell you a lot. If they say, I don't think that's necessary, you could say, what? And they say, why do you want it? Say, I heard it on the internet, that's important. If they laugh you off, might be time for a new doctor. Get your C-peptide test. And if you have high blood pressure, don't just take the pills without understanding the root cause of your high blood pressure. If my blood pressure went up when I was 60, that means when I was 60, my blood sugar already was at an insulin resistant level. I was already at least in prediabetes, if not in a type 2 diabetic state, but never was tested for that. So as my blood pressure continued to increase, they just kept increasing my blood pressure medication, but never checked what the root cause of that blood pressure could have been. Now, after only 4 weeks of intermittent fasting and eating this keto lifestyle, my blood pressure is down to normal, which means it was way up there, guys. And that could have killed me. I instinctively knew that I was on the brink of having some maybe fatal disaster in my life. Now, I want to also say I can be a little bit relieved because I've, tried to reverse things, but I'm still in a danger zone. I'm still there. I heard another thing this morning. Dr. Boz on YouTube, she's very good. She was saying that in a study, the people who had more omega-3 fatty acids in their system versus the people who didn't, when they had a heart attack, they were 91% more likely to die of that heart attack if they didn't have a good level of omega-3s in their system. Her solution, she's like the sardine doctor. She thinks sardines are just the bomb. They are totally full of omega-3 fatty acids. You could also make sure you're eating your salmon and your other things, wild caught, please, your seafood, but it's very important to have those omega-3s in you. I take an omega-3 supplement in the morning. It's just oil with MCT oil and omega-3s and K2. And I ordered that on Amazon. I'll show you that another time, but so I am going to make sure I have enough omega-3s in my system, and I am going to continue on this road. Now, I have heard that one of the ways to get your blood sugar levels down fastest in your blood is by fasting. And I haven't gotten to the point where I feel like I want to fast yet. I'm not ready to fast. However, if that would push me out of pre-diabetes into just normal blood sugar, it might be worth it to not eat for 36 hours. It might just be worth it, and then test it again. If you went to the doctor, they ordered your labs, you want to know more because you're finding out more blood tests that you should have, and I'm learning about this, I will educate you as I learn. There are a few companies that you can actually order your own blood work online. There's one called ownyourlabs.com. And you order it online, you pay for it. I guess it's not that expensive. Some of these tests are like $8, $12, and you order them online. You say what lab you want to go to. The next day you go into the lab, you get the orders for it. They draw your blood. The next day you find out what your results are. This is something that I was going to save for later, because for me, looking at bad blood tests is just like stepping on the scale. It's all reality that you need to know so that you can take charge of your health. But if you're someone like me who's kind of high in the anxiety level, so afraid to die, you don't really want to look at it because, oh, it might do a job on you, you could get them and not look at them for a little while. And then when you're feeling brave and strong, go ahead and look at them. And if they look alarming, they will tell you what's normal and what's not. If they look alarming, you can take them to your doctor and you can say, look, I just did these tests. This is what they say. I guarantee your doctor is going to have this eye opener if those tests are bad. They're going to be like, oh, wow, I didn't check for that. They might not admit it to you, but you will get some better care if you do that. It's not really up to us to doctor ourselves because we put ourselves in the hands of the doctor. But we have to take care of ourselves because what you don't know could kill you.